this already. It usually is an accumulation of calcium in the kidneys. These crystals will form of calcium, and sometimes they'll get dislodged and go down through the passages down to the urethra, and may get lodged somewhere on the way there. So the biggest thing to look out for when suspecting kidney stones is right here, flank pain. I'm pretty sure a lot of you, if not maybe all of you, will get a question regarding kidney stones. And this right here is going to be the biggest giveaway. Now, unilateral means that the pain is only on one side. Bilateral will mean that there would be pain on both sides. But if you see flank pain, it's an indication that the patient may possibly have kidney stones, obviously given the situation and given the cause. But just something to look out for, okay? Renal failure, we talked about this too, occurs when kidneys lose ability to filter the toxins. Now there's different levels as far as severity. See, acute, again, acute means that it just happened. If your patient has acute renal failure, meaning that the kidneys are giving up, and it happened on suddenly, it could be because of shock. So if your patient is going through shock, obviously the tissues of the body are not being perfused. They're not getting oxygen, right? And or glucose. So if that starts to happen, your kidneys, the tissue of the kidneys will begin to die. And once tissue begins to die, it cannot come back. So that could lead to acute renal failure because of shock. And then obviously toxic ingestion. So if your patient drinks something that's really bad for their system, something they shouldn't be drinking, possibly, going back to yesterday's lecture, like Drano or something, they try to commit suicide, right? Or they did something foolish, and they digested something very, very toxic and dangerous to the body or harmful to the body. That can also cause acute renal failure. Chronic, usually it's a genetic thing. It happens over time. And also it's from consuming just a lot of bad stuff, your diet would have to be pretty horrible, and your water intake would have to be pretty low, because water will help balance everything out and kind of helps dilute all the bad stuff that goes into your body. See, so chronic failure may be inherited or secondary to damage from uncontrolled diabetes or hypertension. So diabetes, if it's not controlled, the way this leads to renal failure is because the glucose in your body, if you have too much sugar continuously in the body, the glucose can actually cause damage to the kidneys, because it makes it very viscous, very thick, and very kind of grainy. That's probably the best way I could put it, and that can cause physical damage to everything as far as tissue goes. Hypertension can cause renal failure from the pressure. There's so much pressure in the system, and the blood is rushing so fast that can actually cause damage in itself. There's too much pressure in the system. Too much pressure in the system will eventually lead to damage. Does anybody have any questions about this? Nope. All right. All right, so here we go. End-stage renal disease. So if your patient has this, they are going to be on dialysis. At this point, they need a machine to stay alive. And if they have dialysis, there's two different kinds. There's hemodialysis right here and peritoneal dialysis. Hemodialysis is where you come into play. These patients will usually always need a ride to the clinic to get dialysis, the dialysis clinic, and they tend to have a lot of underlying issues, like they have hypertension, they have diabetes, they can't get around very well, so they might need an ambulance to take them to the dialysis clinic. Peritoneal dialysis, somebody got a question? Nope. All right, let me mute somebody. Mute all. All right, so see, peritoneal dialysis, this is done in home. You would have like a little machine at home and a little pouch, and you would be trained on how to use it and how to replace it. Or if you can't really take care of yourself like that, you might have a nurse or a CNA that comes into your house and helps you with that. See, 90% receive hemodialysis in specialized centers.
Here's
some facts for you guys. So more than 400,000 Americans. Yeah, what's up?
Pertaining to that last slide. So 90% are going to be in a facility. So
Yeah,
that means that 90% are on hemodialysis.
Yes, sir. They're on this.
Okay.
And as an EMT, you are going to have a lot of patients. You're going to come across this a lot. So what I suggest just for you, for your own benefit, all you guys, is to study up ESRD, because you're going to come across it a lot. And it's good to know like what's really going on with your patient. It's for your own sake and for your career. But yeah, so 90% will be going to a facility, and they will be doing hemodialysis, which is where a machine is needed. And they're pretty much connected to a machine. The machine takes out their blood, and it does the job of a kidney. So it filters the blood for you. The blood is taken out, is put into the machine. All the bad stuff is taken out. The good blood is put back into your system, and that's what it does. It takes about, I want to say, about 3 to 4 hours a day, and they have to do it 3 times a day. I mean, I'm sorry, 3 times a week. 3 times a week, and it takes about 3 to 4 hours a day. See, only 8% treat themselves at home. Okay, ESRD patients often rely on EMS for transport. We talked about that already. See, hemodialysis, patient connected to that. So I kind of already talked about this. These patients get hooked up to a machine. The blood's taken out. The bad stuff is left out, and the good blood is put back into the patient. Like it says here, several hours, usually about 3 to 4 hours, like I said. And this gives you an idea of how it works. So the blood is taken out, right? This patient will have something called fistulas, which are like these tubes that are inserted inside the arm, and they go into the vessel, and they're left here permanently. And so they're actually exposed and left out because these patients have to have blood taken out so much that it's better for them to just have these permanent tubes that are placed in their arm. I know working in San Diego, I would never see them on the forearm. I don't think I ever saw them on the forearm, but they would have it like on the bicep area. They would have it either in the bicep area or on one of their clavicles, the chest area, the upper chest area. And I believe it's always on the right side is where it usually is. Okay, so 2 types of access to blood circulation. You have the 2-port catheter and the AV fistula, and I actually have a video that talks about all this stuff right here. So here you go. This is the one that's on the chest, subclavian. So you can see where it kind of goes along right there. And the blood will be taken out of one tube, and the good blood will be put back in through the other tube. This is the one on the bicep that I talked about right here. So these are the common ones. You'll see this in subclavian. Subclavian meaning below the clavicle is where the insertion is, and then you'll see one on the bicep. Why a patient would have one on the forearm, from my understanding, it would be for special reasons, because for some reason they couldn't get one on the bicep or they couldn't get one here. See, uses peritoneal. So for the rest of this, and it's almost over, I'm gonna go ahead and just show you the video for dialysis, because it covers pretty much this, what I already talked about.